So first of all, I would like to thank you for accepting our invitation.
You're welcome.
And I would like to ask you, do you consider yourself a developmental biologist or a cell biologist?
I am probably a little bit of both.
Oh, yeah.
Okay, I think my formal training in graduate school was in cell biology for many years, but I have always worked on reproductive systems, either ovarian development, ovarian physiology, and embryonic development. But I think at the core, I'm a cell biologist. Yeah.
Okay. So what has been your motivation to work with the female gamete?
So my motivation really started long before graduate school. I had an opportunity to work in a laboratory that studied reproductive physiology. And my mentor at the time saw that I was kind of a curious teenager at the time. And he went out and he bought a two-headed microscope and started to show me how to read histology slides of pretty much every aspect of the reproductive tract, but especially the ovary. And that started my interest. And he actually directed me to the person who eventually became my PhD mentor, who is very much an egg biologist. And so there's been no turning back since then.
Yeah, but it was great.
It was,
too.
yes.
Are you comfortable with the treatment avenues that are undertaken by ART? Or
there are some things I'm comfortable with right now, but there are a number of things I'm skeptical of. I think we have seen the evolution of the field from the basic science to the clinical application. Obviously, ART treatments are becoming more and more popular, but the so-called adjuncts to what we do, I think, are a bit extreme. They're being introduced into the clinic before we've really had a chance to do the underlying science that would at least validate using them clinically from both the professional's point of view, those of us who are practitioners, but I also think of the patients. For the last 5 years, I've worked in a clinic where we deal with many older patients, where there are a lot of things working against them besides ovarian aging, etc. And we do our best to try and get some embryos and get some babies out of this. But the introduction of many of these technologies now, I think, it's entering into the realm of clinical practice before we really should be doing it. I mean, one example, even though it's here to stay, is ESHRE.
Yeah.
And as we just heard in the symposium, ESHRE is applied in a widespread way now, but it's not the same as regular fertilization.
Yeah.
We get babies, obviously, but so I remain skeptical about some of the newer technologies. Mostly, and I can name some of them if you want, but
okay.
So I remain skeptical.
And what's your vision of development of ART in, for instance, 15 years?
Yeah, really good question. Where are we going to be in 15 years? I would like to think that within 15 years, this question of choosing the right gametes to use to make an embryo and choosing the right embryo to transfer will finally be something that we will have a secure understanding of. But I'm also very realistic because we're really doing pretty good. When you look at not just pregnancy rates now, because now I think the field understands that live birth rates are really the most important outcome measure, and you begin to look at this from the point of view of our natural fecundity as a species. We're doing pretty good. Okay. We have to remember that in perfectly healthy, fertile couples, maybe a third of the time will a baby result from a natural conception. So So I think, we have to be open-minded about technology as it comes into our field, but I also think we need to be prudent in screening those technologies. Because don't forget, at the end of the day, it's great that we're making babies, but we want to be sure that they're healthy people.
Healthy, yeah.
Okay, and we're getting some signs that, these children seem to be pretty healthy, but we need to keep a close eye on this.
What is your most rewarding achievement?
I think my most
Can you mention
rewarding.
one?
Well, yeah, it's not that I would choose one, but I would look at this stage of my career. I would look back at my career, which, if I had a chance to do it over again, I would. And I think the most gratifying thing to me is to have had the opportunity to train so many young, insightful students and postdocs who are real players in the field right now.
Oh,
And
that's
so
good.
when I come to a meeting like this and I see all my friends and the important things that they're doing, that makes me proud.
Good.
Yeah.
What is your advice for young embryologists and scientists? Do you have one?
Yeah, I do. I really think that it's important, especially in this day of internet and media, etc., to read. Okay, and to really get involved with the literature in our field and learn how to tell the difference between good science and bad science, because that will, in the end, that will dictate the kind of practical embryologist or clinician that you become. But I think that measure of awareness, maturity, and discretion, most of all, is really important for young scientists these days. There's such a strong commercial drive, not just in reproductive medicine. Okay?
And there are a lot of information
This is happening, right, and there's all this information coming out. But, unlike days of old, where not only was there less information, but I think it was more carefully scrutinized before it became public knowledge. But now, as you know, our patients come into the clinic and they sometimes feel like they're more informed than we are, and we're supposed to be the professionals, okay? So I really would urge young scientists to become as discriminating as possible and read the literature, know the literature, and know how to tell the difference between good and bad science.
Well, thank you so much.
You're very welcome.
Pleasure to meet you.
It's a pleasure to meet you, Monica.
Thank you.